Whooping cough. Introduction. Very small brushes called cilia protect the respiratory tract and constantly push mucus out of the lungs. Select true or false. Correct. Whooping cough is most common in adults over 65. Select true or false. Correct. It is most common in babies and young children. Whooping cough begins with cold-like symptoms. Select true or false. Correct. The early symptoms of whooping cough are similar to symptoms of the common cold. After 1 to 2 weeks, severe coughing can begin. Everyone that has whooping cough makes the whooping sound. Select true or false. Correct. The whooping sound is not common in people who get whooping cough after being vaccinated. Antibiotics are always effective in treating whooping cough. Select true or false. Correct. Antibiotics usually don't help if they are started after 3 or 4 weeks of having whooping cough. The bacteria that cause whooping cough are already gone from your body at this point. You should drink plenty of fluid to help the body fight whooping cough. Select true or false. Correct. Drink lots of fluids, especially water. Liquids keep you from becoming dehydrated and help loosen mucus. Whooping cough is contagious. Select true or false. Correct. The bacteria that cause whooping cough are usually found in the fluids of a person's nose and mouth. Sneezing or coughing may spread the infection to others. What is the best way to prevent whooping cough? Choose one of the following options. 1. Drink lots of liquids. 2. Get vaccinated. 3. Avoid public spaces. 4. Wash your hands often. Correct. The best way to prevent whooping cough is by getting vaccinated. Thank you for using Explain.